Our intentions is to develop a world-class healthcare system. In developing a world-class healthcare system, we had to look to see who can be a world-class partner. We were lucky to find two world-class partners, one in Mount Sinai and two in Hess Corporation. As you know, Hess is a private sector partner on this project, and this is part of their social responsibility. We are partnering with Mount Sinai in delivering justice, a modern healthcare system, one in which we'll improve the infrastructure, we'll improve the equipment, the human resource capacity and capability, one in which we'll build health information system, patient management information system, one in which we'll position Guyana's healthcare to a world-class healthcare system.
In this partnership, the Mount Sinai Health System and the ICAM School of Medicine at Mount Sinai get to partner with the government of Guyana to support and supplement and walk along with the Ministry of Health of Guyana as they try to transform the healthcare system for the entire country. It brings in Mount Sinai's greatest strengths in terms of what works best to innovate health systems and how we can create sustainable models for global health and for improving care even in poor places. And together we get to start to work on these transformation efforts in Guyana. It's an incredible opportunity to collaborate with the government of Guyana in this way. We actually get to be part of changing a healthcare system for an entire country. That looks like helping the Guyana Ministry of Health to roll out services that are going to transform the health of the population for the entire future. When kids get access to medical services for the first time, as the government is now making possible, when you're able to get diabetes care right in the community where you live, when the national hospital services move to a level of care that really addresses whatever is needed, that creates a whole new set of possibility and opportunity for the future of the country. We hope that this partnership in Guyana will be something that we can look back on and point to the ways in which it's transformed this country forever. We hope that the people of Guyana, that the next generation of Guyanese citizens will have the kind of healthy, productive futures that we all dream about.
The Mount Sinai team is working closely with our partners in Guyana on multiple fronts. First, we are helping the Georgetown Public Hospital improve the quality and safety of patient care and the overall hospital operations. We are also looking to boost specific clinical services like pathology, cervical cancer treatment, to get people access to the care they need faster. Our Guyanese collaborators are driven, and we are already making positive changes together. When all is said and done, we want the Guyanese healthcare system to be stronger than ever. We are talking reduced wait times, better access to critical services, and an overall healthcare system that the whole country can be proud of.
One, we want to improve the services of the Georgetown Hospital. But whatever we are doing there, we want to replicate it in other parts of the country so that at most of our hospitals, we can use the model that we developed at the Georgetown Hospital to replicate that in the other facilities that we have. In other areas like primary health care, we want to make sure that we can deliver a package of services where people can come to any one of our healthcare facilities and there'll be that standard of care provided across the country. And of course, in school health, we see this making a big impact because if we are able to screen all the children in school and determine if they have any medical issues and solving that early, it would certainly have a big impact on learning outcomes and of course, keeping the children healthy so that they move from childhood into adulthood being quite healthy. Another exciting area is the work that we've been doing in pathology. Recently, we have opened a new pathology lab. We are now able to do digital pathology as well. So when we need a second opinion, we can send digital images to Mount Sinai and the pathologist there can give us a second opinion. I think this is the first time we're having a digital pathology lab in the Caribbean. So it marks a good technological transfer for us here in Guyana, but more so to become one of the leaders in the Caribbean. And we envisage that the work that we're doing here, that other smaller countries in the region would be able to send their pathology samples to us for us to review them and to send them back the test results. All the things that we're doing would result in people living a longer and healthier life.
For the Guyanese people, what I would like to see is a healthier population, a population that has equitable access to health care, one in which the health center in the farthest regions of Guyana can have the same quality of service, same systemic service delivery benchmarks as a healthcare facility in Georgetown, one in which people must have confidence in the healthcare system, one in which our doctors and nurses feel as if they are part of a national good, one in which the public sector and private sector will collaborate to give the citizens of the country the best possible health care. That is what I think the Guyanese citizen can look forward to, a healthcare system that they can be confident to have their parents receive care from, their children receive care from, and every citizen receive care from. It is developing and building a healthcare system that drives confidence in the minds of the Guyanese people and in the hearts of the Guyanese people.
We have a large disease burden for diabetes in Guyana, not just our mortality rates or death rates for diabetes. It's coming with a lot of complications that are not controlled.
Diabetes is amongst one of the 10 leading causes of death in Guyana. And we have found that a lot of persons do not know their status, whether they're pre-diabetic or if they're diabetic. And those who are already diagnosed, they tend to not be adherent to their medication. So we have been offering free services within the public health system, but we've noticed that not a lot of persons know of our services that we have to offer.
We're able to go in the country and look at how they're taking care of diabetes patients right now, the struggles and efforts that they're putting into the care, as well as examining how we can help them improve the care.
Guyanese are used to only going to the doctor when something happens. And our goal here is to try to encourage persons to start taking more preventative measures.
Working with the Ministry of Health, we've been able to bring awareness to our population through sensitization that we're doing with the public through pop-up screening activities. We also do outreaches. These are medical outreaches that we would do in some of the communities, especially the hinterland communities. We really do like to reach to the public. Our goal is to always have population-oriented outreaches so that we can hear from the people, know what they want so that we can be able to provide for them. We had a series of consultations between the groups. We had our local physicians meet with the Mount Sinai team.
Whatever we can do to support you in that way, in particular when it comes to implementation, I think that's what we really want to focus on.
Of course, Mount Sinai provided the expert advice that was needed. We're officially launched. We had training with all of the healthcare workers. We had groups of training from healthcare workers across all 10 regions.
The initial group of physicians that have been trained from all 10 regions will use that implementation guide to go out to their individual and respective regions to conduct additional trainings with other healthcare professionals.
It's a 2-year process. We're in the implementation phase now. As we know, diabetes is a very comprehensive and complex disease. So we want our patients and our healthcare workers to be able to have something that they can be able to work with that's simplified, but yet captures the entire essence of diabetes.
Your plate and your salad should fit in an entire half of the plate when you're eating.
Most of our primary healthcare workers have buy into this guideline and they have started to practice it within their healthcare system. And we have found those who haven't received the training as yet, they have reached out to us and they're asking us, when could we receive this training? We've heard about the new medications that you have introduced within these guidelines. When will we have it?
So our guidelines basically speaks to anyone who's 25 years and above. But of course, the guidelines were tailored to those patients who present with specific symptoms, even if they are younger than 25 years. So basically, we're looking for all those patients who present with symptoms of fatigue, increased appetite, increased thirst, patients who find themselves having to use the washroom more frequently, patients who present with itching of the skin. Of course, those patients who are classified as overweight or obese, we want to capture those patients earlier and just to ensure that we see what the A1C levels are.
Now, this HbA1c testing is our gold standard testing. This is what has been developed in our guidelines, and we're really pushing hard for it. Our government, our Minister of Health, he has ensured that we have all the capabilities and the resources to do so. So we want persons as well who are pregnant or pregnant mothers to ensure that these people are the ones that get screened. A lot of time diabetes isn't caught until it's fully blown. And we know that we have another level such as pre-diabetes, and we really want to catch or capture those persons in that level or that ground.
We have also procured 50 HbA1c machines, which we have distributed to some health centers, and you would find the healthcare workers, you're saying, okay, well, this is a gold standard, this is written within your guidelines, when are we getting these machines? And so it has been well received among our healthcare workers. And also patients too, they're better managed, and you would find one person will go and tell their neighbor, this health center, they're using these new guideline and we're being tested with these new equipments, and so you must join our clinic. So you're finding that persons are accessing care.
For achieving the standard of care. The idea is that the patient will receive all of these services to be able to get good control. A patient who has diabetes can get foot screening, eye screening, A1C testing, dietary counseling, exercise counseling, rehabilitation, all under one roof.
The doctors and nurses really doing a good job here. Every patient, all the patients get treatment equally. In the races, in the favoritism, not just equally everyone. The doctor and nurse really good to patients here. Really good.
We're looking at how this will progress. It's a collaborative effort. Mount Sinai has provided the technical support with the goal of providing the skills and the knowledge that patients will need to manage their diabetes and live healthier lives.
Since we started Godless at Guyana Health Center, Diabetic Center, my family lifestyle changed as well because the doctors and nurses really doing a good job there and take care of the patients very well. So I advise you how to eat, how to exercise, what kind of medication to use. Every single day is a different advice. Like your meals. And it's more important thing you're eating. When you're diabetic, the most important thing you have to watch your eating. So I'm thankful for Los Guyana Health Center, Diabetic Center. The doctor advised you the right thing. And doing the right thing so you live healthier. And live longer. According to my knowledge, you live longer. So me live happier and better and healthier.
We had a large campaign during the Caribbean Premier League games, CPL games, where we did a campaign called Go for Six. And the Go for Six campaign basically highlighted 6 things that a diabetic should do to have better control of the disease.
Collaborating with an international partner, this has really opened our eyes, and I believe that a lot of persons will now access our service.
In our country, we are now trying to get there.
After extensive conversation with Mount Sinai, it was determined that we needed to build an entirely new pathology laboratory. Building a new pathology laboratory is a huge undertaking, and it comes with a lot of challenges. First, we needed to find a suitable space on the hospital compound. A lot of planning had to go into ensuring it was correctly configured for our needs. The renovation involved bringing in a lot of carpenters, plumbers, and electricians. We needed to complete renovation before we could have moved in the new equipment that were purchased for this new laboratory. We received a lot of state-of-the-art equipment that needed to be calibrated by specialists and placed in the appropriate locations. All of this, of course, ends up taking up a lot of time. We had anticipated a shorter turnaround time for that, but with everything, it took a little bit longer. There were some minor challenges, but then they all came together quite nicely. It is what we were looking for. It is what we were hoping for. And we now have, a safe environment and spacious environment with a flow for our persons to be able to function with.
The way pathology has emerged now, you need experienced doctors to replace some of this technician cadre. But we don't have any training in Guyana for these things. And so right now, in terms of people preparing specimens, processing the specimens, utilizing the modern equipment that we have to train them. And so they have been to Mount Sinai. They have worked in the lab, so far 4 people. We are now sending 4 more persons to Mount Sinai. And they are working alongside, they're learning by doing work alongside the professionals, some of the global best professionals.
It's been said oftentimes that human resource is our main asset. We can build this infrastructure. We can buy all the new equipment. It'll all be a waste of time if we don't train the people to use it effectively, and in order to produce a diagnosis. So to train it at Mount Sinai, I myself had the privilege of going to Mount Sinai and I went through their pathology lab. I had a tour through it. After my visit, sending our staff there for training was an easy task to get them there. And obviously, with the new equipment here and the training, will certainly improve and boost our operation efficiencies of the pathology lab and our turnaround time for diagnosis. Therefore, we will be able to treat patients in a timely manner.
I had the opportunity to visit Mount Sinai as well. And when I visited there, basically what we were looking at, what is it that we would like to see our pathology lab looking at, having the exposure to an international laboratory. And it was a really good experience, I must say. And all the staff that were given the opportunity to have that extended training there, they came back, they're more enthusiastic about their work. They are looking forward to the changes. They are looking forward to the implementation of the systems. Now they can actually relate to what is being implemented. They can put the pieces together like a little puzzle and make it all one.
In the work environment and out of the work environment, I had a lot of great experience with the leadership that was put forward. And it's something that I looked up to and I admired, especially from Dr. Nakadar and the other staff at Mount Sinai. What I can bring back definitely to Guyana is all of the knowledge that we would have learned from how pathology lab is organized and how it's structured and how it's run and operate on a daily basis.
My experience in training at Mount Sinai, New York was phenomenal. It incorporated a whole lot that we don't do back home here in Guyana, in terms that they use a lot of technology, which is great in a fast-growing age.
We got to learn new techniques in embedding, sectioning, staining. We were introduced to new areas such as immunohistochemistry and frozen section and telepathology that we do not have back home. So it was really informative. The benefits the digital pathology training will bring to Guyana and to myself and the lab. For myself, it means the enhancement of my skills and knowledge. For my colleagues, it would mean they also will enhance in their knowledge and skills as well. And for the people of Guyana, it means that it will improve our diagnostic process, which will improve our efficiency. It will reduce our turnaround time, which will eventually means better patient care for the people as well.
What excites me most about our new lab is that we'll be having a laboratory information system, which will take us to things being electronic rather than manual. That will help a lot in our turnaround time. And also that we'll be having top of the class equipment. It's like the very best in terms of brand and the versions. And that's going to help give our patients the best results we can.
Will benefit.
Guyana is in the process of doing something really visionary, and that is creating this national health information system. Unfortunately, with that come enormous challenges. Some of the challenges anybody who would be doing this faces, and examples would be, am I choosing the right product? Am I choosing the right vendor? How do I change the way I think? Other ones are, if not unique to Guyana, certainly novel in the Guyanese context. And some of the challenges include this. Number one is connectivity. And remember, we're trying to design a national health information system. We want to make sure that when you're seen at a health post and you get referred to Georgetown Public Hospital, GPHC, that the records from the health post make it all the way up. So that's one challenge they have. Another challenge is going to be around workforce. The population is just now really rising up in some of these areas, technology, information systems, and other technical specialties. And the result is that who will run the system? Who will own the system? Because while we can pay vendors to do a lot of that, ultimately, this is a Guyanese resource. It's a Guyanese tool.
And we thought that just having a software and putting it into a computer and doctors and nurses begin to use them, that it will happen like that. It didn't. It couldn't. One group that we never thought about was the group that worked on the system, the IT infrastructure, the IT people. Introducing EHR means that we have to create in the health sector an entirely new cadre of health workers.
People need to be trained, people need to be supported, but none of these people really exist in Guyana. There's some tremendous technical people who work for the government, but not health information systems people. So one of the tasks that we have undertaken as part of this work stream is to actually build a comprehensive applied health information systems and technology training program with 2 tracks. One's a clinical track, so we can get those clinical champions that we really need to help guide their colleagues. And one is what we would consider a more traditional track, the people who train, who operate, and who manage health information systems.
A national electronic health record has the potential for several benefits to a country that implements one, ranging from better clinical care to the more administrative, academic, or policy-making aspects of the healthcare system. Take, for instance, improved clinical care. Because of the fact that there will now be better communication and access to data, clinicians can be supported in adhering to more guideline-directed engagement with their patients, and there could be clinical decision-making that is more accurate and more efficient. I am most thrilled about the potential for improved communication between healthcare providers and various systems such as laboratory systems, radiology systems. I believe that with a centralized database, the inefficiencies that are caused by having to go search paper records for data, having to contact providers by telephone if a patient comes from another hospital or another service, even the elimination of missing data, lost charts. These are things that I believe would significantly impact our healthcare practice and ultimately the service to our patients.
From birth onwards through the life cycle, through the life process, everyone will know what came before. They will know if you have an allergy to a medication. They will know if you broke your arm at an early age. They will know if you have asthma. Wherever you go for healthcare in the country, that sort of continuity of care is extraordinary and something that much of the world is still working to achieve. That's benefit number one. Benefit number two, obviously, is efficiency in the healthcare process. Every time the patient shows up, we don't have to repeat the story. The patient isn't burdened with having to remember what happened 3 years ago. All of this is documented. And finally, of course, is the opportunity to begin to inform public health policy and to begin to understand what are the trends in our population, what do our people need, and then to become predictive so that we can anticipate the public health and personal health needs of our community rather than having a bunch of boxes with a bunch of pieces of paper that have to be rifled and shuffled through and hope for the best.
Having greater access to data has potential to be a positive thing, to impact positively on our development of healthcare. The research potential would be significantly improved, and because research would be improved, we will be able to make healthcare decisions that are more in keeping with our population, and thus probably be able to address issues that our population face in a more accurate and direct way.
One of the broad challenges that Guyana faces is around how to manage data. Not just manage it as in store it, but how to join the global digital world. Big issue there is data protection, privacy, security, how to legislate that, how to think about it, how to manage that. The truth is that those things didn't really exist to any great degree in Guyana. So in our work with the government, we collaborated to build the Data Protection Act of 2023. And through the offices in the Ministry of Health, Parliamentary Council, we worked with them to write this new legislation, to pass it. And as a result, every person in Guyana now has a way to ensure that their data are their data, that it's private. Mount Sinai, in collaboration with the ministry and the government, did this in record time, produced what was recently referred to as the gold standard of this type of legislation in the Caribbean, and I would argue in the world.
When you do new things as a developing country, people are skeptical. And whether the international community is skeptical or not, don't bother me that much. But we need to ensure that our own citizens are not skeptical. And when you have a partner like Mount Sinai, it allows your citizen to have a greater deal of confidence. And so when we select our partners, we have that in mind, that we need to ensure that we're not foisting things on people, but that people have some confidence that we can do this right because we have the right partners with us. And so the legitimacy issue, creating confidence in our population, are significant factors in this partnership. And that's what excites me. Excites me to see that an entity, a world-class entity that has gone through this, are with us, and we are walking together on this journey.
We have been giving a high standard of quality healthcare to our people, but we are very grateful for this collaboration with Mount Sinai. And ultimately, it's to improve operation efficiencies. If we improve operation efficiency, therefore the outcome and impact will be better patient care, patient experience, patient outcome. There have been many lessons learned, and we work together to tailor it to best suit our culture and our dynamics. I, along with several other colleagues, have had the privilege to visit Mount Sinai and see the different ways they do process and different medical treatment. And we come back here and try to use that with best practice to improve ours as well.
We have 15 work streams currently going on all across the Georgetown Public Hospital Center. We're really focused on three things. First is improving the quality and safety of care that's delivered each and every day to each and every one of the patients that enters through their doors. The second thing that we're working on is operations. There are a lot of opportunities in our work at Georgetown Public Hospital Center to really improve the operations such that we reduce waste and improve the experience of patients. And then third, we're training the staff. So we're training the staff in how to do process improvement work. We're training the staff in information technology. We're training the staff in how to do root cause analyses. We're training the staff in the basics of quality and safety. We want to see that work lead to results. We want to see that work lead to improved outcomes.
The Georgetown Public Hospital Corporation, the GPHC, has been providing for many years a very high standard of care. But we believe that quality and patient safety is not just an unintended outcome of good technical work. We recognize that there needs to be certified or a proper system in place to give us these outcomes that we wish. Now, Mount Sinai, our counterparts in North America, are among the best, the leaders in providing quality and patient safety. So we believe that working with our counterparts at Mount Sinai to build sustainably good systems where we focus on quality and patient safety is one of the ways we can really raise the standard of care over time.
So currently at GPHC for over a year, we've been working with the infection prevention team here to develop a hand hygiene program, which we've launched on 2 inpatient wards. Hand hygiene is fundamental to safety. Everybody must wash their hands if we're going to ever try to prevent infection. The program here does a few things. One, it ensures that the hospital has both the supplies and processes it needs to have the materials for people to wash their hands, either with a sanitizer or soap and water. Second, it trains observers who come from the staff to be able to provide data back to the unit and the hospital about how well people are doing at washing hands. We know from data from all over the world that if people who are in hospitals will reliably wash their hands, we can decrease the rates of infections of all types.
Hand hygiene doesn't sound all that big a deal, but to the extent that best practices are followed in hand hygiene, you reduce the infection rates and reduce hospital-acquired conditions. Use best practices for hand hygiene, you reduce hospital-acquired conditions, you reduce infections, you keep patients safe, you can send them home.
Our work with GPHC and Mount Sinai will help the team here at GPHC to be able to develop a structure and a process to be able to tackle quality and safety issues that arise in the course of delivering care. Through that, we hope that the team here will get data that'll help them to make better decisions about how to provide safer care, therefore ensuring more trust with the public and making the people who deliver care here feel safe and proud of what they do.
What I believe is that we need to change and improve the culture of recognizing adverse events and have a culture of reporting them. We believe from our research that these are underreported, and to improve care and safety, we really need to have staff report these things. The root cause analysis gives us a very methodical approach to review why these things happen, and without blaming anyone, we look at the system objectively and decide what are the things we need to put in place to ensure that these adverse events do not recur. In doing this, again, we make it a safer environment in which we provide patient care and services.
This will allow anybody in the healthcare system to feel that they can raise a concern and know that that'll be looked at by the people who oversee that area. Once a concern is identified, the team here can systematically analyze and approach a safety concern by using tools such as process maps and causal trees. From that, the team can then find safety solutions to improve care, and hopefully, as they do that, find what things they can spread to the rest of the hospital. Does everybody agree to this?
We've trained nurses in the use of daily management boards. Daily management boards allow the nursing teams on the units to escalate issues that need to be addressed that day. They also allow them to convey information to different shifts, and they allow and support improvement work that we want the nurses to try to do on the floors.
A nursing huddle generally occurs twice a day or more frequently as needed, and is simply a gathering of the nursing team, usually at the daily management boards, where the oncoming and the outgoing shifts are afforded the opportunity to give a brief handoff and update about the state and flow and safety of the unit.
The aim is to promote safe care. So for example, we can talk about staffing levels. That can be one key component of the huddle discussion. We can talk about any safety issues that we would have had to deal with during the last 24 hours or even the last 12 hours. Then we take that to the main huddle, where multidisciplinary team is a part of that meeting, and all key persons are in that huddle who is or might be responsible for some of those tasks or activities that is needed to make that thing better.
Proper patient identification is still one of the top reasons for serious adverse events all around the world. And according to the World Health Organization, throughout the healthcare industry, the failure to correctly identify patients continues to result in medication errors, transfusion errors, testing errors, wrong person procedures, and the discharge of infants to the wrong families. So one of the ways that we can prevent this is by the proper use of patient identification bands, which are placed on patients when they are admitted for treatment or procedures. We are very proud of the work that we have done together with the GPHC nursing team to help drive this patient safety goal.
It is really important that every single patient wears an identification band. It helps in all spheres of what we have to do on a daily basis, and even if we turn up to do medication rounds, we want to know we're at the correct patient. If the patient is going for a specific investigation, we want to ensure that it's the right patient we're sending and it's the right patient turning up to that department. So it is really key to patient safety.
So we're really excited about the partnership between Mount Sinai International and the pharmacy leadership at the Georgetown Public Hospital Center. We've done 3 workshops to date, really on the foundations, the basics of medication management and medication administration and medication safety.
The first workshop, which was around inventory management, looked at how medication came into the hospital. How did the team decide what they would need for the year? What areas did they need to focus a little bit more closely on? What medication were they going to use more of? What did they think they would need less of? And what were the best ways to conduct our process in the most efficient way? The second one was around medication dispensation. And basically, we looked at the different ways that medication got to the patient. How did it get from the pharmacy to the ward to the patient? And we found that there are different ways that this was happening that maybe we could improve upon. The third workshop which brought all this together, was the medication administration workshop. And this really took a much closer look at how patients actually receive their medication. So medication is now on the floor. How does a nurse give it to the patient? How does the patient receive that medication? What does that process look like? The other thing during that workshop that we discussed and we reviewed was having an automatic dispensing cabinet, this technology that's used in many hospitals around the world that makes sure that there's an appropriate amount of inventory on the floor, on the ward, available and accessible to the nurse, readily available to him or her. So we're working on that. It's actually a pilot program that we're working on in the NICU.
This really helps us ensure that we minimize or even eliminate medication administration mistakes. Why is that important? That's important because you want to make sure that patients are safe.
It's a very good tool for accountability for managing of pharmaceuticals, medications, and also it's effective in eliminating or minimizing the risk of medication error.
It's our hope that when people see how these machines protect and secure the medication and reduce or hopefully eliminate medication errors, that the desire will be to use these machines not just at the Georgetown Public Hospital Center, but at hospitals all across the country.
GPHC emergency department is not just the face of the hospital, but it's the face of emergency for the entire country. This is the place that never sleeps. So it functions to manage medical emergencies for the city and for the entire country. Last year we saw 55,000 patients. The numbers have been increasing between 20 to 40% yearly. At this stage, as we currently speak, we see on an average 170 to 200 patients on a 24-hour basis. I think we've done a good job in the front end in terms of trying to get patients in to be seen by physicians in an efficient way. Our current waiting times are less than an hour to see a doctor, so the door-to-doctor time. What we've found is that once we've seen the patients, there are still some variables that are challenging us from getting patients to be dispositioned in a more efficient way. Disposition means that either you're going to be admitted or you're going to be discharged. The time that it takes for you to be seen back by the doctor for either to be admitted or be discharged, there are numerous factors that affect that. We're hoping to work and collaborate with our group at Mount Sinai to help, one, eliminate some of those factors, and two, to identify the factors that are necessary and find ways to improve the efficiency of those factors so that patients can be either admitted or discharged in a faster way.
Patient flow is something we struggle with in the States as well. At Mount Sinai, really just how do we get patients into an emergency department, seen in a timely fashion by the doctor, have everything they need to get done, and ultimately discharged from the emergency department. Now, that may seem simple on the face of it, but it really adds very intricate steps of how the patient can get from one point to another point to another point, the waiting times in between, how do you manage expectations for them. So we've been working with them on patient flow, sort of looking at their processes, and today we just did exactly that. And there's some interventions, some ideas we can give them. They have a fairly busy emergency department. They manage to do things similarly, and some of the things they're doing, they do just as equally as well as we do it. So I'm also learning things as we go. So really helping them manage the patient flow, how we can get patients through from the beginning of the process to the end of the process, I think is critically important.
So our goal now is to identify those throughput and output factors and try to eliminate the ones that can be eliminated and streamline the ones that are needed in a more efficient way so that we can get better response from the different support services that are needed to get patients in the emergency disposition in a more efficient
whether it's in the hinterland regions, all children through the school system get some level of a comprehensive health screening done.
So the important thing with this screening program is that we're trying to identify what are some of the health conditions that children who are in school may have, and have an opportunity to have early treatment so that they can have a very good quality of life. We started with the nursery school, and we've now been able to screen over 11,000 children for nursery 1 and nursery 2. Children before they go home for the end of the day. With the basic screening that is done for every child, you identify whether it is normal or whether there's an abnormality. And from that, the child is then sent on to a second phase of screening, which is done by the technical person of that area, whether it be an optometrist, whether it be a speech therapist. So the services we provide are mainly speech therapy, occupational therapy, and audiology services for the school screening program. We look for auditory impairment to ensure that their hearing levels are acceptable. And if your hearing level is not acceptable, then your speech will not develop. Speech impacts learning. So if we're able to correct that early, then they'll be able to learn much quicker and develop like a normal child. In the sessions, the therapist is completely invested at that time. So it's the therapist and that child for half an hour, and there's nothing else. Like they're in a room and it's focused on what can help this child to develop their speech. It could be a simple puzzle book, or a simple book with animals inside, and you're asking the child to identify the animals and just to articulate it with the right pronunciation so that people could understand.
My hope is that the service we provide makes such a great impact that they develop the ability to speak and comprehend as a normal child would. Usually in schools and so forth, if a child is not to par with the other children, then, a lot of times they're shunned, put aside. So we want to prevent that from happening. We want everyone to have equal opportunity to learn.
This project allows us to ensure that even the kids going to school in the remote areas, in the remotest of areas of Guyana, will receive some level of comprehensive screening, that we could collect data on those screenings, and then we can offer the interventions that those kids need. So it wouldn't matter where they are. They wouldn't have to be living in the capital to get access to great health care. That we can work together to ensure that even the kiddos in the hinterland region get access to the care. So that focuses on the accessibility aspect of healthcare that we think is very important. But it also speaks to the equity of healthcare. That is a very important pillar and focus for us at Mount Sinai.
Healthy children become healthy adults, and that contributes to a healthy society. So writ large, that's the most important thing that's coming out. But then, of course, there's also effects on the health system, making sure that the Ministry of Health and the government can plan in the long term for the things that they know they're going to need to provide to children and adolescents who have health issues. So I see potential for incredible long-term impact of this project.
Within the context of our country, children look after parents when they grow older. You have the opportunity to have your child survive childhood and survive adolescence and become adults that can be founders of their community who can contribute. And it goes along with parents even having their children pass on their legacy. Because health is important and survival is the thing that we're looking at. And not just survival. We want our children to thrive and to transform the country that they're living in. So it's very important that you get your child screened. It is important also because they start learning healthy lifestyle choices. They start learning about how and why it's important to be screened and to have your checkup done on a yearly basis.
Here in Port Kaitumo, we really don't have access to certain things because of maybe the equipment, lack of equipment here at the Port Kaitumo Hospital. And we welcome it as a parent. And I must say thank you very much.